Hello, Clinic Review family. It's Dr. Sharon with Clinic Reviews. I've been going through the RN test plan and picking out topics that I think will be helpful to you. Today we're doing management of care. So let's go ahead and get started. Hello, Clinic Review family. It's Dr. Sharon with Clinic Reviews, the home of the very best Nclex review in the entire universe. In my opinion, Mark Klimek is the GOAT of Nclex reviews. And if you go to clinicreviews.com, you can find our 21 plus hour Nclex review. It's online on demand. Mark is close to being done doing reviews, but he's still got a few more years in him, I think. And if you want to come to Ohio, you can see him in person for 3 days. It's the same thing that he does online on demand. We also have a streaming service. And if you want to meet me over Zoom, you can sign up for our small group tutoring. I do 2 of the sessions. It's a 1 month, 4-session package. I do 2 of the sessions and I teach you how to do next gen case studies. So let's go ahead and get started. I picked the topics under management of care. I picked care planning, like updating the care plan, evaluating outcomes, things like that. And I picked staff management, like conflict with staff and so forth. Okay. So let's go ahead and do those. A nurse caring for a newly admitted client notes incomplete allergy information in the plan of care. What should the nurse do first? Document no known drug allergies and continue care. Ask the charge nurse to obtain allergy details later. Pause medication administration to verify allergies with the client and family. Administer only routine medications until the physician clarifies. All right, what should the nurse do first? Incomplete allergy information. Well, we can't just document no known allergies. Like, we got to know. We got to ask the patient. Okay, so I'm going to cross off A. I'm not going to put it off. That's not the best option. So B is out. And I can't administer routine meds until the physician clarifies. I can't administer anything until I get clarification. The physician doesn't have to clarify it. The patient has to clarify it. So I'm going to do C, pause med administration to verify allergies with the client and family. The physician does not have to verify the allergies before I can pass meds. I have to. It's the RNs. That's our scope of practice to ask about allergy information. A post-op client refuses to use an incentive spirometer even after education. Which is the best nursing action? Best means I can only do one thing, so I've got to pick the one thing I have to do. Document the refusal and notify respiratory therapy. You know what? I'll just read them all and then do it. Re-educate, explore concerns, and negotiate a realistic usage schedule. Ask the provider to prescribe bronchodilators instead. Tell the client hospital policy requires spirometer use. All right, so I would not do D. That's definitely not what I would do. Document the refusal and notify respiratory therapy. I mean, if they absolutely refuse, A is not wrong. It's not wrong. I could do that. But I don't really like notifying respiratory therapy because that's not a good Nclex answer. Because what I'm saying is, well, I guess I can't do anything about it. I better let RT take care of it. And that's not the way Nclex wants you to answer questions. They don't want you to pawn it off on somebody else. Mark calls that the chicken answer, like you let somebody else take care of the problem. So A seems like the chicken answer to me. Re-educate, explore concerns, and negotiate a realistic usage schedule. That seems good. And the Nclex is a perfect world. So I would be able to negotiate a realistic usage schedule on the Nclex. Ask the provider to prescribe bronchodilators. That's not as good as B. I mean, we want them to do incentive spirometry. Okay. That's what we want them to do, not bronchodilators. I don't know that they have a problem with bronchoconstriction. Incentive spirometry is prevent post-op pneumonia. It's not to bronchodilate. Okay. So I'm going to do B. During interprofessional rounds, a physical therapist dismisses the nurse's concern about a client's dizziness with ambulation. What is the nurse's priority response? Voice the concern firmly and suggest delaying ambulation until reassessment. Accept the therapist's expertise and proceed with ambulation. Ask the charge nurse to resolve the disagreement later. Document the disagreement and take no further action. All right, so there's really 3 things when it comes to problems with other staff. It could be something that they're doing that's illegal. Could be something that they're doing that's harmful to patients, or it could be something that's not illegal, not harmful, just inappropriate. Well, this one seems harmful to me. This is harmful to the patient. And when another staff member is doing something that's potentially harmful to the patient, I have to intervene immediately. And A is intervening immediately. B is doing nothing. You don't ever want to do nothing. Okay. If they're doing something that can harm the patient, don't do nothing. So B is out. Asking somebody else to resolve it later is okay if it's just inappropriate behavior. If it's inappropriate behavior, it's legal. It's not harmful. It's just inappropriate. I could ask to resolve it later. That's fine. But this is potentially harmful. So C is not the best answer. Document the disagreement, take no action. Really, that's the same as doing nothing. I mean, B and D is both doing nothing. And I have to intervene immediately. That's what I have to do. So when I say you have to intervene immediately, if it's potentially harmful to the patient, you have to look for the answer that indicates you intervene immediately. What you don't want to do is look for the answer that you like best, because if you do the one that you're like, oh, that's what I would do. Yeah, that may not be the right answer. You have to look for the right thing. If it's an illegal behavior, you have to notify the supervisor. Okay, if it's illegal, notify the supervisor. If it's harmful, you have to intervene immediately. If it's just inappropriate, you can intervene later on or do something later on, talk to them later on. Never choose the do nothing option. Which task is appropriate to delegate to an experienced UAP on a unit with high conflict between staff roles? Obtain a sterile wound culture, perform a focused neuro assessment, report low urine output trends to the provider, remind client to use incentive spirometer after initial teaching. Okay, so they say high conflict between staff roles, but that doesn't seem to have any impact on this question. I'm not going to change what I'm going to delegate to the UAP based on conflict in staff roles. I'm going to delegate to the UAP what is appropriate for their scope of practice. Doesn't matter if there's conflict in staff roles. And they cannot obtain a sterile wound culture. They cannot do an assessment. Don't do that. They don't report trends to the provider. They can measure things, but they don't monitor them or report trends. Even if they can't even report trends to me, like they can report measurements to me, but not trends. And so they can remind the client to do something that is an ADL. They can't teach it, but they can remind to do it. So they can remind a patient to brush their teeth. They can remind a patient to stand up slowly. They can remind a patient to take deep breaths. Okay, they can remind patients to do things that are essentially ADLs. So that's appropriate. That would be appropriate for them to do. A confused client's son demands to see their chart, which is the best nursing action. Provide the chart since the client lacks capacity. Refer the request to the unit's social worker. Explain that only authorized individuals may view records. Allow viewing, but remain in the room to supervise. All right. Well, they're demanding to do something that actually is illegal because HIPAA says I can't let anyone view medical records unless they're authorized. So A is out because it's illegal. I don't want to, I could refer the request to the unit social worker. I could do that. Doesn't seem best though. And this is best nursing action because it's always best if I can intervene as soon as possible. And so explaining that only authorized individuals may view records is true, and it's immediately. And then if he still won't do it, then I wouldn't report it to the social worker. I'd report it to my supervisor, to be honest, because he's asking to do an illegal thing. So I'd report it to my supervisor, probably not the social worker because they're not my supervisor. Allow viewing, but remain in the room to supervise. No, because that's illegal to do. So I have to explain. And remember, best answer is best because of the other answers. If they had the option to report it to my supervisor instead of C, I would have picked that. A new nurse's documentation repeatedly lacks objective data. Which of the following is the preceptor's best response? All right, so they're not doing anything illegal and they're not really doing anything harmful. So I really don't have to report it. So let's see. Inform the new nurse that the charting does not meet expectations. Well, that's true. It doesn't. Discuss examples of objective wording and comprehensive charting. Okay, well, that's good because I'm teaching them instead of just telling them it doesn't meet expectations. Report the nurse to the nurse manager. I don't have to do that. It's not illegal. Ignore it. Okay, I don't ever want to ignore it. So I have to choose between inform the nurse the charting does not meet expectations, but don't discuss examples of objective wording and comprehensive charting. Or I could discuss examples of objective wording and comprehensive charting, but not inform them that the charting does not meet expectations. So B seems like a better answer. It seems like B is addressing the problem and not just telling them they're doing it wrong. So B is definitely the better answer. A nurse manager notes escalating tension between two nurses arguing about assignment fairness, which is the best nursing action. Okay, so is this illegal? No. Is it harmful? Okay, don't turn this into a community violence question. It doesn't tell us that one of the nurses has a history of violence. It doesn't tell us one of the nurses is carrying a gun or a knife or has a history of hitting people. Like, it doesn't say that, so don't read into it. We only know what they tell us, and all we know is there's tension. So that's not illegal. That's not harmful. It's just inappropriate. So offer to reassign their patients to another unit. No. That's a weird answer. Issue written warnings for unprofessional conduct. That's not really best because it's not really illegal or harmful. Ask other staff which nurse is correct before intervening. Maybe. Ask them to return to patient care and bring them in for discussion later. So I like that best. So what that does is it gets them back to doing what they have to do. And then we can bring them in for a discussion later. So the only time you can bring somebody in for a discussion later is when what they're doing is not illegal. So it's legal and it's not harmful. So I'm going to do D. Now, if it said take them to a room privately and discuss their concerns, I could have picked that if that were there instead of D. So if D were not there, like D is really the best answer, but if D were not there, I would take them into a private room and discuss their concerns. So what you want to do is get them away from all the public stuff, right? If you can, you want to get them to return to patient care because that's what they're here to do. You got to do get back to taking care of your patients. Stop fighting. We'll talk about this later, right? That's really the best thing to do. Which action by the nurse reflects evaluation of a client's plan of care related to impaired mobility? So we have assessment, planning, diagnosis, assessment, ADPI, assessment, diagnosis, planning, interventions, and evaluation. So evaluation is seeing if what I did worked. Performing passive range of motion exercises, recording intake and output, comparing today's gait distance to the weekly goal, updating interventions, delegating ambulation to the UAP. So performing passive range of motions is an intervention. Recording intake and output, at best, that's an intervention, just doing something. Comparing today's gait distance to the weekly goal and updating interventions, that's evaluation. That's exactly what evaluation is. Delegating ambulation to the UAP, that's an intervention. So we need to evaluate, are they doing what they're supposed to be? So I'm going to compare it to the goal. Are they meeting the goal? Are they not? I can update interventions. Which outcome statement is most appropriate when initiating a care plan for ineffective airway clearance? So ineffective airway clearance is I can't clear my airway. I have secretions in my airway that I can't secrete. So an outcome for that, without even looking at the answers, it seems like an outcome would be to have a clear airway. So that I'm looking for something that indicates a clear airway. Client will achieve clear breath sounds within 48 hours. So that's a clear airway. Client will use incentive spirometer frequently. That's not an outcome, that's an intervention. Client's oxygen saturation will improve. That's an outcome, but it's not related to ineffective airway clearance. That would be impaired oxygen saturation or impaired oxygenation. I can't remember the exact one, but it's not airway clearance. Nurse will assess lung sounds each shift. That's an intervention. So ineffective airway clearance is I have secretions in my airway, so I want to have clear breath sounds. A nurse is revising a plan of care for a client with heart failure who gained 2 kg in 24 hours. Which of the following are appropriate nursing actions? Okay, so I had a plan of care for a patient with heart failure, and they've still gained 2 kg, which is 4.4 pounds in 24 hours. Y'all, that's a lot. So they're holding on to fluid somewhere. Okay, so I need to do something to prevent them from holding on to fluid. Restrict sodium intake to 2 grams, increase IV fluids to maintain hydration, apply sequential compression devices continuously, obtain a stat serum BNP level, educate about daily weight monitoring, encourage high potassium foods. So I want to get fluids off because they've gained weight. So restricting sodium should help get fluids off. It's not real fast, but it'll help. Increasing IV fluids is not going to decrease fluid or get fluids off. Applying sequential compression devices might be good, but we don't ever apply them continuously. So don't say you're going to do something the wrong way, hoping you'll get it right. It's not going to be right if you do it the wrong way. So C is not the right way to do it. Obtain a stat serum BNP. Well, that could tell me if their heart failure is getting worse. So that's okay. I like D. Educate about daily weight monitoring. That's fine. I can educate them about that. Encourage high potassium foods. That's not going to do anything to get the weight off. So those are the only 3 that are appropriate for someone who's holding on to fluids with heart failure. A site client threatens a peer during group therapy. Which of the following are appropriate nursing actions? Escort the aggressive client to a quiet room. Apply restraints to the aggressive client. Use de-escalation techniques such as calm voice and personal space. Document the incident objectively in the chart and request standby assistance from other trained staff. All right, so a client threatens a peer during group therapy. So what we need to do is we need to de-escalate the situation, and taking them to another room is a form of de-escalation. So A is an action of is a de-escalation action, and it's appropriate. So that's good. Apply restraints is not a de-escalation action, actually. And so I'm not going to do that. And then C actually says use de-escalation. So taking them to a quiet space plus using a calm voice and giving them some personal space, those are all de-escalation techniques, which are good when someone's aggressive or threatening violence. Documenting the incident objectively is always a good thing to do. Request standby assistance from other trained staff. You don't want to have to take them down if you don't have to, but y'all, if you can't de-escalate the situation, which is your goal to de-escalate, you got to have some staff on standby in case you need to take them down. So let's not take them down yet, but let's get them on standby in case we need to. A nurse observes a physician speaking harshly to a client who refuses treatment. Which of the following are appropriate nursing actions? All right, so observes a physician speaking harshly. Is that illegal? I don't know. I don't know if it's illegal. It certainly is harmful. Like, that's harmful. Even if it's just psychologically or emotionally harmful, that's harmful, right? So I can't let that continue. Interrupt and offer to explain treatment options calmly. Advise the client to file a complaint tomorrow. Report the behavior through institutional chain of command. Document the episode factually in the medical record. Ignore it, the physician is frustrated. Well, I'm not going to do E because we never just ignore inappropriate staff behavior. Now, this is why you don't say, which one sounds good to me? Because what you say is, this is harmful behavior. I have to do something immediately. And A is the immediate option. Interrupt and offer to explain treatment options. Even if you say, I would never do that, it doesn't matter. On the Nclex, they want you to interrupt. If you see somebody harming a patient, you have to interrupt. You can't let it continue. So I have to do A. Now, I'm not going to advise the client to file a complaint tomorrow. That's not what we do. Even if you would do it in real life, that's not a good Nclex answer. Report the behavior through institutional chain of command. So I don't know that this is illegal, but whenever it says report through the correct chain of command, that's always a pretty good Nclex answer. And if you're not sure if it's illegal, like, I don't know, but that seems really inappropriate, then I think reporting it through the institutional chain of command would be appropriate, because you're not their boss, right? Like, I mean, if it was a UAP, maybe I wouldn't report it through the chain of command. I don't know that I would. But for someone, they're not my boss, they have a lot of power, I think reporting it through the institutional chain of command is appropriate, and documenting the episode factually in the medical record. So that's the one I kind of hesitated on, because, like, I might type up an incident report, which is reporting the behavior through the institutional chain of command is typing up an incident report, right? That's what that is. But would I put it in the medical record? And I think I would, but I would have to do it very, very objectively. So I would say physician X was in the room talking to the patient Y. This is what patient X said. And I wouldn't say what I thought about it. I wouldn't say it was inappropriate. I wouldn't say anything like that. I would just say, this is what happened and this is what I did. So I would want it in the medical record to protect myself, because if the doctor came back and was like getting mad at me, I'd want a record of it somewhere. But you have to make sure you're very, very objective. And when you're objective and factual, you're not saying what you think about it. Like, you're not making a judgment call on it. You're just reporting what happened. When developing a discharge plan, which nursing actions demonstrate collaborative care? So collaborative care is working with other disciplines. Consulting physical therapy to assess home ambulation safety. completing all discharge instructions independently, coordinating with social work for home health services, verifying prescriptions are affordable for the client, delegating medication teaching to the UAP. Well, I wouldn't delegate medication teaching to the UAP. That's not collaborative care because UAP is not a discipline. So disciplines are those that have a license. So PT is discipline, OT is a discipline, medicine is a discipline, pharmacy is a discipline, chaplaincy is a discipline. I don't know if they have a license, but they have something that allows them to practice, right? So disciplines are those that have some kind of certification or not certification, license. They have a scope of practice and a license to do that scope of practice, and UAPs don't have that. All right, so consulting physical therapy, that's working with another discipline. Completing all discharge instructions independently is just doing my own thing. That's not it. Coordinating with social work, they do have a license, so that's fine. They're another discipline. Verifying prescriptions are affordable for the client. So you're like, well, what discipline are you working with? Well, I would have to work with social work. I would probably have to work maybe with pharmacy. Like I couldn't do that by myself. I would have to work with another discipline to do that. So when you answer these questions, you have to use common sense and clinical reasoning and say, could I do D by myself? I don't know how I could, because I'd have to talk to pharmacy and see what the copays are. And then I can go to the patient, find that out. So even though it doesn't say work with pharmacy to verify prescriptions are affordable, I would have to do that anyway. Which nursing interventions are best for an older adult who expresses fear about a recommended invasive procedure? So this is care planning, right? This is when it says which interventions are appropriate. This is care planning, which is management of care. Provide evidence-based written material in large font. Arrange for a second opinion at the client's request. Inform the client refusal may lead to discharge against medical advice. Offer presence of a family member during consent discussions. Obtain verbal consent over the phone immediately. Okay, we've got an older adult who expresses fear about a recommended invasive procedure. So what is going to help with their fear? Provide evidence-based written material in large font. Could that help with fear? Yeah, because it gives them time to read it. It's age appropriate. It gives them time to read it and to process it. Arrange for a second opinion at the client's request. So if it said arrange for a second opinion, period, I wouldn't pick it. But if it says arrange for a second opinion at the client's request, I would do that because that's advocating for the client. I want to advocate for the client. They're fearful. They're not sure if they want this, so I can advocate for them. Inform the client refusal may lead to discharge against medical advice. Absolutely not. Don't say that. I know, y'all, I know in real life sometimes we say that, but like don't do it. Like really, I don't do that. I don't do it even when I'm asked to do it because people can leave against medical advice, but honestly, I've never discharged them against medical advice. Like that doesn't even happen. Offer presence of a family member during consent discussions. Yeah, that's advocating for the patient, saying, do you want somebody else here when we talk with you about it? Okay, and then verbal consent over the phone immediately. That doesn't do anything to alleviate their fear. That's not advocating for them. Now, in case I wasn't clear, informing the client refusal may lead to discharge against medical advice. The reason I said that doesn't happen is we don't discharge patients against medical advice. People can leave against medical advice, but we don't discharge them against medical advice. That doesn't happen. So read the answers carefully. Okay, that's it. I hope this was helpful, y'all. There's tons of stuff in management of care. Management of care is about 25% of your Nclex, and I want you to be comfortable with it. So I'll probably do more. I also do the blue book, and then sometimes I just do topics because I like to do topics. All right. Good luck on your Nclex. I'll see you later.